Welcome to Safely Combining Next Generation Chemical Peels with Devices and Techniques. I'm Danae Markland. I'm a licensed esthetician and certified medical laser technician for over 20 years, and I'm also the Vice President of Clinical Development and Partnerships for LinderHealth. I'm super excited to be here today to talk all about safely combining next generation or non-inflammatory chemical peels with different devices and techniques you're already using in your practice. I hope you learned something new and you enjoy. Now, customization is key to results. We can't treat every patient the same when they come in. No two conditions will present exactly the same way, and we must customize to reach the unique needs of each individual. Our toolbox has all kinds of tools in it, and we utilize and leverage those tools together in order to get the very best results. So we must understand how each of these technologies works individually in order to understand how to safely combine. So we will review how different methods of things like exfoliation, stimulation, and emulation take place in the treatment room to give us the results that we look for. We're going to talk about how to combine safely. Safety is key. So combining with care means making sure that we're pairing each treatment by itself before we combine it together, and making sure that patients are acclimated to more aggressive treatment slowly rather than jumping right in. So we'll talk more about that. The main goal of any workshop that we do is to make you more successful. We want to give you the tools and information that you need in order to be the most successful clinician you can be. No two patients will be the same. You're never going to have two cases of acne that present itself exactly the same way from person to person. It's important that we recognize the additional underlying skin concerns that might be paired with the main condition that we're being presented with. So understanding all of the concerns that are present and being able to treat all of them at once. We're often faced with multiple conditions in one setting, and that could be that someone has rosacea in their cheek area and hyperpigmentation on their forehead. So how do we make sure that we're treating both things at the same time? We also can see new things pop up throughout a treatment plan. So we have to be able to pivot and not necessarily do the same treatments each and every time, because the skin can be different every time the same person comes in. And then difficult to treat skin conditions, things like melasma, deeper skin conditions like grade 4 acne might require multiple approaches and deeper penetration of the ingredients that we're using. So we want to make sure that combination therapies come into play with these more difficult to treat conditions so that we get the very best results as quickly as possible. Now, this is a great example of multiple conditions presenting at once. We have fine lines, wrinkles, discoloration, redness, impaired barrier, flakiness, loss of volume, all kinds of different things presenting in one image. And by combining multiple treatments, we're able to get very significant results after just one treatment with no downtime at all. So this patient received one dermaplaning treatment followed by a 15% mandelic acid, 10% lactic acid, and 3% tranexamic acid chemical peel. All of that utilizes a delivery system called transcutol to carry the acids into the skin where they're going to do the most good with no inflammation. The anti-inflammatory nature of these peels is key to being able to pair them safely with the devices we'll be talking about today. So this is just one example of what we can expect to see after just one treatment while combining non-inflammatory next generation chemical peels with different techniques such as dermaplaning. Now, our toolbox has all kinds of different toys to play with, and we are fortunate to have multiple methods of treatment at our disposal. No matter what you have on your treatment room, we can pair it safely with non-inflammatory chemical peels. The first type of treatment we offer is exfoliation. It's one of the most common, and we'll talk about that in depth. The next type is to stimulate. We want to stimulate change in the skin and the cells via things like light therapy, for example. So this is things like LED, laser, IPL. We'll talk more about that in depth. And then we have things that emulate what our skin should be doing on its own. So these are things like injectable fillers, and we'll talk about that in more detail. All of these types of devices can be safely combined with next generation chemical peels. First, we have exfoliation. Exfoliation is the process of cell turnover and the desquamation process. So different types of exfoliation induce different levels of cell turnover and desquamation in the skin. And we'll talk about those different types of exfoliation in detail. Chemical, enzymatic, and physical exfoliation all take place in the treatment room, and they all have their benefits. Mechanical or physical exfoliation has all different types of options, things like dermaplaning, microdermabrasion, or even physical scrubs. Now, chemical peels are some of the most common and date back to the ancient Egyptians with Cleopatra taking her milk baths. There's also history pointing people in the direction of fire and even urine to exfoliate the skin in the early days. So thankfully, modern peeling began over 100 years ago, utilizing things like TCA, phenol, and eventually alpha hydroxy acid. So chemical peels are defined as the application of acids that dissolve the bonds that hold the corneocytes and keratinocytes together, or acids that dissolve the actual skin cells themselves. So we either dissolve the desmosomes or the glue that holds the cells together, or we dissolve the actual skin cell itself. And that has everything to do with the type of acid and the percentage of acid that we're using. Whether we completely burn the skin or if we merely take care of the bonds that hold the skin cells together is a very different approach to chemical peeling. And that is why some peels induce massive amounts of irritation in the treatment room and downtime after the service. And some treatments, like non-inflammatory next generation chemical peels, offer no downtime but significant results. The wound healing response is a traditional and primary mechanism of action for minimally invasive procedures that we offer, like traditional chemical peels. They are, on the pro side, positive because they increase cell turnover and collagen stimulation, and they reduce imperfections like breakouts and fine lines and wrinkles and discoloration. On the con side, we are inducing a chemical injury with traditional chemical peels, and that induces inflammation. This causes discomfort during the treatment. This increases the amount of post-treatment limitations, like not being able to work out and not being able to sweat or be outside after the treatment. And this also increases the risks of post-inflammatory hyperpigmentation, for example, as well as the amount of downtime and flaking that someone might experience from a treatment. All of these things are responsible for the results that you get from a chemical peel, but they are also responsible for a lot of the downsides that we get from traditional chemical peels. Traditional chemical peels versus next generation chemical peels in determining peel depth. Traditional chemical peels, as well as next generation chemical peels, will rely on things like previous condition of the skin. If the skin has been exfoliated recently versus someone who has never exfoliated in their life, then the condition of the skin might be different. If someone's using something like a Retin-A before the treatment, then that might dictate depth of penetration. So understanding what the condition of the skin is before you peel them. The method of application, if you're using a fan brush versus a cotton pad, these will dictate a little bit of a difference in depth of penetration. The number of layers. For certain peels, such as next generation chemical peels, you're going to use the number of layers to determine how deeply the peel penetrates. And then in time on tissue, with things like straight alpha hydroxy acid, straight glycolic acid, or lactic acid peels, you might have to neutralize them, and that is also referred to as time on tissue. And then last but not least, we have the two most important and the two most potentially inflammatory components of determining peel depth, and that is the type and percentage of acid used and the pH of the solution that is used. Both of those determine depth of peel penetration, but they both also increase the amount of inflammation associated with the treatment itself. Next generation chemical peels utilize delivery systems to carry the acids into the skin where they'll do the most good without causing surface irritation. Transcutol, for example, is one delivery system that can be used in chemical peels to carry both lipophilic and hydrophilic ingredients deeper into the skin without surface irritation. Overcoming inflammation can be done by several factors, and by doing so, we create senolytic activities in the skin, reducing the skin's senescent cells. If we have a pH between 3 to 3.5 and use lower total percentage of acids, we decrease the risks associated with chemical peels, things like post-inflammatory hyperpigmentation especially. And we don't use any corrosive peeling agents such as TCA or resorcinol. This makes the treatment safe and effective for all skin types and concerns, including all Fitzpatricks. We can also safely combine with all devices, which is everything we're talking about today. With next generation chemical peels, there's no prep required. So you can take people literally who walk in off the streets that are using nothing but dial soap and still have an option to peel them with. You can also treat people who are using things like Retin-A right up until the day of treatment. This doesn't mean that you'll do the maximum number of layers of the strongest peel on these people. It just means that you'll have options so you never have to turn anyone away. There's no neutralization required. So everything is layer and leave on. Nothing is timed. It's very simple to apply the product in up to 6 layers in order to get your depth of penetration. There's no sheet peeling. Everything comes off in dandruff-like flakes, so it's very light and tolerable. People can wear makeup throughout the entire process. And there's no social downtime, so they can go right back to their daily life right after the peel. People can work out and sweat. They can be outdoors. They just have to wear sunscreen and reapply every 2 hours if they're going to be outside. And that also means that there is no seasonality. So this will improve consistency of your results. It will continue results throughout the year, because how frustrating is it in the summertime to get so far in the treatment room with our results and have compliance until we get to the summer months, and then one vacation ruins everything and we have to start all over again. That is not necessary with next generation chemical peels. We can peel throughout the summer months. Again, that doesn't mean that we're doing the strongest peel with the most number of layers all summer long. It just means that we can utilize the peels at our hands that are using the appropriate percentages of acids at the appropriate concentrations and at the appropriate pH to get those safe results every time. This means that you'll increase revenue, and you can perform these treatments safely every 2 weeks so that way you get the very best results all year round. Finally, we wanted to make sure each treatment was cost effective for you as the clinician. Each treatment is approximately $3 for you, and we have a national average price of about $150 per treatment on average. Each treatment is also incredibly stable, with a shelf life of up to 3 years with all of the peels. And there's no consumables, so no additional products for you to have to buy. Here's an example of what a peel alone might do. This is an example of a 15% mandelic with 10% lactic, 3% tranexamic acid, all in a trans-Q-tol delivery system with a 1.25% retinol booster that contains CoQ10 and squalane. Here's a great example of how close we can get to the eye area with next generation chemical peels. They don't creep or leach into the eye area after you've applied them. So you can go right up to the lash line. I don't touch the lash line, but I get very close to it, and I press using a cotton pad in order to get that application precise. And here's an example of what next generation chemical peels can do for acne. Different masks and facials have been used for centuries to treat the skin and improve the appearance of the skin. It dates back to ancient Ayurvedic medicine, and this is responsible for both nourishment as well as exfoliation for the skin. And facials are very popular treatments that include various types of masks for their benefits. Enzymes are one of the most popular exfoliating type of masks, and we use different types of fruit enzymes to dissolve keratin, the protein that's in the skin. So we use things like bromelain or pineapple, papain or papaya, and pumpkin, all very popular enzymes, but there's very many more. Apply the chemical peel after you've done an enzyme or exfoliating or nourishing mask of your choice. Because next generation chemical peels are self-neutralizing, you'll layer and leave them on. So you don't want to apply a mask that you would remove after a next generation chemical peel. You'll always apply it before, remove it with water completely, and then apply the peel of your choice. Next generation chemical peels can be incorporated into traditional facials as well. Do the exfoliating mask with steam, then extract and disinfect. After that, massage. Remove any traces of the massage medium and follow up with the chemical peel and the retinoid booster. You can finish them off with sunscreen and a moisturizer. Here's an example of just one treatment with someone who received an enzyme mask with pineapple, papaya, and pomegranate enzymes, and then immediately followed by a 15% glycerin, 12% lactic, 3% mandelic, and 3% TXA chemical peel with the trans-Q-tol delivery system. Mechanical exfoliation or physical exfoliation includes different types of devices or techniques that abrade the surface of the skin using an abrasive media of some sort. This is things like microderm or hydrodermabrasion, dermaplaning, different mechanical scrubs that you might use on the face, as well as sponges or loofahs, all different types of mechanical or abrasive type of exfoliation. Microdermabrasion dates back to the ancient Egyptians, where they used different forms of sandpaper to abrade the surface of the skin. Traditional surgical dermabrasion utilizes things like metal brushes in order to abrade the surface of the skin, but more modern microdermabrasion, what we use today, uses things like aluminum oxide or hydroderm or water for exfoliating benefits. Different microdermabrasion or hydrodermabrasion devices use different media to abrade the surface of the skin. Aluminum oxide and sodium bicarbonate are probably the most common crystals used. There's also quite often an encrusted diamond or crystal encrusted wand that is utilized. Sometimes nylon brush bristles are utilized. And of course, as I've mentioned, hydrodermabrasion is very popular. For microderm and hydrodermabrasion, you will use the chemical peel after you've done the dermabrasion step. If you're using the hydrofacial device specifically, then you will utilize the chemical peel at the exfoliation step. You can either use it in addition to the peel solution of your choice by the hydrofacial or in replacement of the peel solution. Dermaplaning is one of the newest forms of exfoliation we have available to us, and this is where a surgical blade is used to remove not only surface cells but also vellus hair. So it's a very popular treatment because it treats multiple concerns at once. Dermaplaning should be done before the next generation chemical peel for best results and for more even and deeper peel penetration. Our next category of treatments are those that stimulate. They either stimulate the wound healing response by triggering some sort of wound, which cascades into triggering collagen production, or they stimulate biological change via light therapy. The wound healing response is a complex process, but it's broken down into different phases. The homeostasis phase, where blood flow is reduced, followed by the inflammatory phase, where redness, swelling, heat, and pain are associated. Then we have the proliferative phase, where new tissue is generated and collagen starts to be produced along with new blood vessels. And then we have the remodeling phase, which can last for weeks or months after the wound has been closed. And this is where collagen is reorganized and strengthened. When it comes to light therapy treatments, we have three main options, and they all have varying strengths as far as energy and heat is concerned. The lightest, and the one most like a Volkswagen Beetle, is LED. The middle of the road that disperses a good amount of energy but a low amount of heat because it's dispersed over a larger area is IPL, which is like a Hummer. And then the Mack truck of them all is the laser. The Mac Daddy, the one that employs all the heat and all the energy to get the biggest change in the skin. Laser or IPL should be done before the chemical peel, and the skin should be allowed to cool completely before the chemical peel is applied. Allow up to 10 minutes prior to applying the chemical peel, and consider cryotherapy like cryoglobes or Glacial RX or any of these devices in order to cool the skin down quickly. LED works by light being absorbed into the skin cells to create different biochemical changes. It works by producing ATP, or adenosine triphosphate, which is the energy source for our cells and crucial to mitochondrial health. It's going to help to stimulate collagen production and increase elasticity in the skin. It will help to reduce inflammation and increase circulation. There are multiple benefits to LED, and it depends on the different lights that you use to get these different benefits. LED should be done on clean, dry skin so that the light can be absorbed by the skin cell with no reflection. Do the LED and then apply up to 6 layers of the next generation chemical peel. And here is an example of just 2 LED treatments combined with a next generation chemical peel that contained 15% mandelic, 10% lactic, 3% tranexamic, all in a transcutaneous delivery system. Emulate means we are either injecting something into the skin or triggering the electrical currents in the skin, like with microcurrent, for example, that we are emulating specific change in the skin due to exactly what we've put on it or in it. Microcurrent mimics our electrical currents that occur within the body. It produces ATP, or adenosine triphosphate, to respirize the cells. It increases cell membrane permeability, so it will increase product penetration. And it enhances circulation and increases neuromuscular stimulation for an instant tightening effect. Instant, but not long-lasting. So cumulative effects are very important when it comes to microcurrent. Microcurrent increases circulation. It stimulates collagen and elastin production. It provides cumulative skin tightening, which is why I mentioned it needs to be done on a regular and consistent basis for best results. And this will reduce fine lines and wrinkles. It's often referred to as the 30-minute facelift, and it will also promote overall skin health via circulation. Microcurrent should be done before the non-inflammatory chemical peel. Apply up to 6 layers of the non-inflammatory chemical peel after the microcurrent treatment. Nanoinfusion is another example of emulation. Nanoinfusion will create a permeable barrier in what is typically impermeable, which is our stratum corneum. So it creates microchannels in the stratum corneum to allow for proper product penetration, and we can increase the penetration of things like next generation chemical peels for even better results. After you've cleansed and degreased, you'll infuse the skin with the appropriate targeted serum of your choice. Something with hyaluronic acid is typically most appropriate. After you've nano-infused that into the skin, you will apply up to 3 layers of the appropriate next generation chemical peel. Here's an example of a nano-infusion treatment followed immediately by a 15% glycerin with 12% lactic, 3% mandelic, 3% tranexamic, and all in a transcutaneous delivery system. Finally, injectables. Injectables are a stimulator as well, depending on what you get injected. First, we have neurotoxins. Neurotoxins are things like Botox, Dysport, Xeomin, and others. We have neurotoxins that temporarily inhibit the repetitive motion that lead to expression lines. And we have topical ingredients that can do that as well. So it's important to use those ingredients like our Argireline along with your neurotoxins. And then we have fillers that build volume in certain areas. You can see on the face diagrams here where those certain injectables will do the most good. Currently, fillers are falling out of favor. We're not sure how long fillers are staying in the body. And so things are questionable right now as far as fillers are concerned. You'll do the injectable before you do the chemical peel because you want to inject on a sterile environment. You can apply up to 6 layers of the appropriate chemical peel immediately after you've injected. Avoid over-manipulation of the skin post-injectable. And consider using a targeted hyaluronic acid and Argireline serum to massage into the skin after your injectable very lightly. Don't over-manipulate. Now, Argireline, as I mentioned, is a neuropeptide that works similarly to a neurotoxin, but isn't quite as effective. Argireline will inhibit the repetitive motion that lead to expression lines a little bit less effectively than a neurotoxin will. If a neurotoxin or Botox, for example, is a roadblock as you're driving down the road and there's simply no way to get around it, then Argireline is like you're driving down that same road and it starts to rain heavily. You can still get through the road, but it might just take you a little bit longer and be a little bit more difficult. Now, we can also use topical forms of hyaluronic acid. If we use low molecular weights down at 3,000 Daltons, then we're able to actually penetrate through the epidermis into the dermis, stimulating our own hyaluronic acid production. And then higher molecular weights will sit on the surface, just creating a humectant type effect to hydrate the surface of the skin. Here's an example of what a multi-weight hyaluronic acid-based product along with niacinamide and Argireline peptide can do to the crow's feet area after just 30 days. So we've seen multiple ways to safely combine next generation chemical peels with different devices and techniques today. Let's review just quickly how to safely combine in general. First and foremost, combination therapy is reserved for skin that you are very familiar with and that you've treated safely many times before. You always want to make sure that you've performed each treatment alone successfully before you try to combine. And we always want to consider the manufacturer's recommendations. What I've taught you today is what I know, and in most instances will apply, but certain manufacturers might have different recommendations, and always follow those recommendations. And always start slow. You can always work your way up and get stronger with treatments. It's much more difficult to work your way backwards if you went too hard to begin with. To summarize, we want to customize protocols and treatment plans for the very fast and most dramatic results we can get. This will help with patient loyalty and increase revenue streams for your practice. If we can understand and utilize our entire toolbox that we have available to us safely and efficiently, then we can stimulate, emulate, and exfoliate in the best ways possible, and we can combine those different techniques together to get the fastest and reliable outcomes exclusive to your practice. So creating these protocols exclusive to you. I'm Danae Markland, and I am so grateful that you stuck around today to learn more about combining next generation chemical peels with the devices and techniques you're already using in your practice. If you have any more questions, feel free to reach out to me or to my team, and we'll get back to you as soon as possible. Thanks a lot. Have a great rest of your day.